You have to also honor where you are in the world and where you are with yourself, because maybe 100% raw is not right for you, because if you're eating 30%, 40% or more of your calories coming from fats and you're not feeling great, that's not as healthy as if you're incorporating a little bit of cooked food, cooked healthy food, and feeling better. For me, that's really clear. But I think we can start struggling with, I should be, it's ideal to be. And I think letting go of the shoulds and feeling into where do I feel my most vibrant and going from there. I think when you do that, then maybe in the future you get to a place where you say, okay, now I'm in a place where I can let go a little bit of this other food.
The Vidal Speaks Podcast.
Episode 127, Dr. Tumi Johnson MD, Living the Raw Food Fruitarian Lifestyle and Advice to Move in That Direction. Welcome to Vidal Speaks. My name is Deborah Vidal, former 11-year LPGA golf pro turned classical homeopath, certified plant-based nutritionist, and wellness coach. Each week here on Vidal Speaks, we bring you knowledge, inspiration, or natural remedies to help you take charge of your health and feel your best. I believe health is freedom and knowledge is power, so tuning in each week will give you the power to take steps towards freeing yourself from the chains that hold you back from having the energy to do all you want in life. No matter where you are in your journey of wellness, Vidal Speaks can help. I promise. Hello, my friends. Welcome back to another episode of the Vidal Speaks podcast. I love so much hosting my podcast. It's really one of my most favorite things to do in life. I hope you can tell how much I love it when you listen to my passionate interviews with so many people on all different walks in life, but yet they all have a huge common mission to help others heal and learn how to take charge of their health. Through my podcast, I've met so many amazing people and I feel connected with many of them, and I share the passion of their work of helping others. Over the years, as you know, there's been many guests, many topics, and I hope they've all been helpful and interesting for you, and I'll do my best to keep them coming. So before I tell you about today's guest, let me give you a bit of news. So my final updates to my already new website will be up in a week or so. So keep checking, okay? Because I had some professional pictures taken by our friend Ben. Ben's a Hollywood movie photographer. His name's Ben Glass, and he shoots our crazy Christmas cards. Have you guys ever seen them? If you haven't seen them, then go to my blog and you'll just go scroll down and look back, and you'll see at Christmas time I post a Merry Christmas and you'll see them. They're crazy. That's Ben. He's an amazing photographer. So if you guys have seen our Christmas cards over the years, then you'll know what I mean. So Ben, who's been out of town because his mom recently passed and he's been dealing with all of that, poor guy. But anyway, he was able to come back to LA for a bit and shoot my pictures, and I'm so appreciative because, geez, I can't believe the difference it makes to have professional photos, and I can't wait for you guys to see them. There's a lot of new ones that are going to go up on the site. Well, not tons, but a lot of the big banner posters on my site are going to be different. And also on my new site, you're going to see that I'm going to have my first online course offer. It's called To Supplement or Not to Supplement. Here lies the answer. And I'm super excited about this because this is a topic that everyone has asked me to talk more and more about. And I talk about the essential supplements that we should take. I give all the facts and reasons why and why not. I explain nature's law. I tell you why certain supplements could even be harmful. And I also offer some alternatives to supplements. So I think you're going to learn a lot and love it. And the other offering that I'm very excited about that's going to be coming out in a week or two will be my VS Club. It's going to begin soon. Well, let's put it this way. As soon as you're ready to sign up, it will start. It's my paid private classroom. That's the way I like to call it, but it's really called Vidal Speaks Club or VS Club. But it'll be a place where I can teach all of those who are interested in learning everything I know about how to use homeopathy in a practical way or an everyday way, how to detox, including using homeopathic remedies for detox. But in addition, all kinds of other natural remedies or tools or methodologies or whatever it is you want to know, how to use food to heal ourselves, how to prepare healthy foods, whatever it is you guys want to know. Basically, I want to answer all your questions because I want to teach you what you want to know. So if you have a desire to learn more from me, then be ready to check out the VS Club. I'm offering a great introductory offer, so check it out as soon as my updates go live, which should be in about a week or so. And lastly, I want to tell you that all of you that can't afford any of my paid offerings like my courses or my VS Club, then once I get established, I want to let you know that I'm going to be giving away free scholarships every year, both for the courses and the VS Club, because I am a person that wants to help everybody, even those that can't afford to pay. But you would have to apply for a scholarship, so you can just email me and then we'll go from there. And just remember that when you pay for any service from Vidal Speaks, I will donate a big chunk of my profits to my favorite charities that are working to save our animals, food, oceans, water, and our Mother Earth. So by changing your health, you are directly deciding to help change the world. Be sure and keep your eyes open for this new update on my site because it's coming any day and I'm super excited about it. Okay, now that said, let's talk about my guest today. Her name is Dr. Tumi Johnson. Dr. Tumi is traditionally a trained medical doctor, meaning an MD. And I learned about her firsthand, a few years ago, and I kept saying, my friend Dan told me about her, and I kept saying, yeah, I need to contact her and get her on my show. And for some reason, it just never happened. But Dr. Tumi is an MD that started working with Doctors Without Borders. You know, those are those groups of doctors that get together in countries of need to help people in need. Well, she decided to do that. And when she went there, she learned firsthand how food is medicine because she witnessed amazing healings during her work there. That experience awakened her to take action and heal herself and put her on this path to truly help her patients now using food, movement, and other lifestyle and emotional changes. She's truly an amazing person who walks the walk and not just talks the talk. She speaks from love and compassion, and I can tell you that her desire to help people heal themselves is huge. And this is what I love about my podcast, when I can connect to people who have that same passion. It just feels so powerful. And I know I tell you every episode, this is my favorite interview ever. I say that all the time. But this one really is so genuine and so passionate and so loving. But really, it's just so real. We just speak about our truths, our difficulties, our experiences along this raw food vegan journey. I think you're going to love this one, guys. But before we get started, what do I have to do? Yep, I got to tell you a little bit more about Dr. Tumi. So here we go. Dr. Tumi Johnson is an integrative holistic medical doctor. She is board certified in internal medicine and is also a diplomat of the American Board of Integrative Holistic Medicine. Dr. Johnson graduated from Vanderbilt University Medical School, receiving the honor of her school's Kaufman Prize in Medicine for humaneness and unselfish service in medicine. She completed her medical residency at NYU with a focus in internal medicine, primary care, receiving special training in psychological health care at that time. As a physician, Dr. Johnson has worked in many clinical settings. She was made assistant professor of medicine at NYU in 2011. A graduate of the Institute of Integrative Nutrition, she is also has the expertise in nutrition with past experience running a weight management clinic in New York and serving in West Africa with Doctors Without Borders to oversee nutrition classes. She has also done medical volunteer work in the Amazon, Haiti, and Kenya, among other places. Dr. Johnson has been a consistent yoga practitioner for over 20 years and completed yoga teacher training with Yoga Works in 2012. She's also a dancer and creates and performs her healing poem dances around the world. You guys have got to see these. They're amazing. These dances are crafted and performed by Dr. Johnson with the intention of supporting the healing process of whoever watches or witnesses her movement. For more information about her dance, check out TumiJohnson.com and see the video. Dr. Tumi was disheartened by our currently unhealthy medical system. Therefore, she created a holistic medical practice to offer an alternative solution in which more time could be given to her patients to truly understand the root of their health issues. She wanted to be able to offer holistic medical advice that is uniquely tailored to the individual. It is also important to her that it could be done in the comfort of their own home or through Skype or phone sessions for greater ease and flexibility. She doesn't believe in prescribing only medications to quiet bothersome symptoms. One should ask themselves, she says, why did these symptoms arise in the first place, especially if they keep coming back? And she believes that symptoms are the body, mind, and spirit's way of communicating to us that disease is in balance. Her rich medical experience has shown her that the key to true and lasting health is by identifying the underlying cause that may be hindering the natural tendency towards self-healing and using a holistic therapeutic plan that's unique for each individual that supports not just wellness, but sustains optimal health. All right, are you guys ready? Well, let's go meet Dr. Tumi. Welcome to the Vidal Speaks podcast, Dr. Tumi. I'm so excited to have you on my show because whenever I find an MD doctor that understands the concept that food is medicine, then I want to jump up and down in celebration and I want to chat with them about all their experiences of treating their patients like this. So welcome.
Thank you so much, Deborah, and thanks for having me.
Oh, I'm really excited. I've known about your work because I'm in LA and I know you're in LA, although you're not right now. That's why we're doing Skype, but you're going to come back into my studio and we're going to do more when you come back in town. So give us a little update. First of all, I know you're not in LA anymore, but tell us a little bit about your practice in LA and where you are now. And then maybe from there, transition into how you got into being a medical doctor on the food and nutrition and healthy journey.
Sure, that's a great starting point. So I'll take you back a little bit before that. I did my medical school training at Vanderbilt Medical School, which I had a fantastic medical school, but a very traditional medical school training. Then I moved to New York where I did my residency. And I bring that up because I actually ended up spending 10 years in New York City. During my residency, I went away abroad to do Doctors Without Borders, to work as a field doctor in Africa for a year. And then when I returned there, a lot of shifts happened for me while I was in Africa and doing that work in West Africa. I worked in clinic. I worked in clinics and in hospitals as a hospitalist and a clinician, but something shifted in me in terms of an awareness, increased awareness of food being medicine, because my work as a field doctor with MSF, Médecins Sans Frontières, or Doctors Without Borders, was working as the field doctor in a hospital taking care of malnourished children and their mothers.
Wow.
And that's where I really got to see food as medicine. In medical school, we got very little nutrition training, as people I think more and more know. A lot of us doctors don't get a lot of nutrition training. And it wasn't until I joined MSF, had nutrition training, went to the field for about a year, saw the power of getting out of the body's way, basically, to heal, and seeing emaciated children flourish with good nutrition and letting the body heal. So when I came back from that experience, I was totally changed, and I couldn't just go back into the system. So long story short, I'm also a dancer. I joined a dance company. I was working part-time as a doctor. I moved to California because California just seemed to have, at that time, um, more resonance with me in terms of philosophy around holistic medicine. I was more and more pulled towards holistic medicine. My family was also there. So I moved to a little town called Ojai, which is near and dear to my heart. Ojai, California is about 90 minutes from LA by car, and it's an incredible town. A lot of healers, a lot of people doing healing work. And I really did a lot of self work and immersed myself in crafting my holistic practice. So my practice actually is home-based and Skype-based. I still work in clinic whenever I'm in the States, and in Ojai, California, there's a clinic that I will go in, and it's a regular clinic, but the medical director is amazing and has seen the results of my work with the patients. So she tells me, do whatever you do because it's resulting in amazing things. So I bring my yoga mat. Everybody gets a food diary. I want to know what you're eating. So I bring in a holistic approach to a traditional clinic.
Cool.
But what I really focus on is my practice, which is, again, home and Skype based. I go to people's homes. And then because we were traveling so much, my husband and I see patients over Skype, especially because you probably know this, Deborah, so much of people's struggles with health is based on lifestyle and chronic stuff that we can do online, and that I will partner with people's primary care doctors also to help them. So that's what my practice has been looking like. And then I basically fell in love. I went to Thailand to teach yoga and dancing and doing some holistic health work there, and met my amazing sweetheart of a husband. And we fell in love, started traveling about 5 years ago now, 4.5 years ago. And that's why I left California.
Yeah. And wow, don't forget the last part of you and your husband where you just told me that you're pregnant.
Yes. So I'm
Congrats.
a little bit over 5 months. Thank you so much.
Yeah. So how far along are you?
I'm a little over 5 months now.
Great. And how's that Fruitarian pregnancy going?
It's, I knew the data, I knew the science behind it before, but experiencing it, I want to share, I'm almost 42 years old.
Wow.
And experiencing getting pregnant with such ease, and also having such an easeful pregnancy, when I think the usual expectation is that it'd be very difficult. I had no morning sickness whatsoever. I didn't have that debilitating fatigue. I've been feeling energized throughout. My body definitely needs rest because I'm making a human within me, but it's been so easeful. And I know a huge part of that is that I'm feeding myself the food we were meant to eat as human beings, I believe. Nutrient dense, water rich fruits and lots of vegetables, of course, and some other things. But it's been a fruit-based raw vegan pregnancy. And
wow,
I feel
that's
amazing.
So cool. That's really, and that's, what attracted me to come search you. I've heard about you. Our friend Dan told us about you because he was really on the Fruitarian journey for a while. And then that introduced me to you. And I kept saying for 3 years, I got to write Dr. Tumi and get her on my show. But, when the time's right, now I'm more ready for it because I've interviewed other raw food vegans. I did a 1.5 years of eating almost only all fruit. Wow. Like 99.5% probably, to help Lloyd heal his idiopathic neuropathy, or to try to heal it. We're still in the progress of working on that. But so that made me even more excited to seek out other people doing high fruit diets, whether they're fruitarians or not. But there's so much, bad stuff around that tells people that they should fear fruit. So that's why I like to get people on the show that do it and eat like that and that have experience. And with you being a medical doctor, even more value because it's so opposite of what a medical doctor would normally prescribe. And I know you've written a book now, right?
Yeah. Yes, yeah. Thank you for mentioning it. I wrote a book was published last year called Delicious Healing. And that shares about my personal, because we were talking before we started recording, Deborah. I think what makes some of us healers so powerful or drawn to the healing work is our own personal health
Yes,
struggles.
right.
And
Is there really
definitely,
any healer? I think it's very rare that you find a healer that isn't, their journey didn't start with their own healing. I know there are some, they're just driven to help people. But I think most healers are because they've had to do so much research to help themselves.
absolutely. And you've had to face yourself and look, it's the practical research, but also sitting with yourself and feeling what suffering is like.
For
So you can
sure.
bring that compassion to others. So Delicious Healing is an interesting blend. That book is a blend of sharing my own personal healing journey from being a sick doctor, a lot of deep depression and physical issues such as pretty bad eczema and asthma, disordered eating behavior. So from there to being, I really feel I'll say this unapologetically and hopefully to empower others. I am living my best life and I feel so incredible. I feel the healthiest that I keep feeling more and more healthy. And so that transformation story is shared and I share kind of the 7 realms of health that were really important to me. And chapter 1 is about food being their medicine. I call it delicious food as thy medicine because I also think that healthy plant-based food gets a bad rap about not being delicious, and that's not the
True.
case.
That's so true. That is so true. So I love that you share your story in your book. I've had the chance to read most of it. And
Oh
I
wow.
really love, because that's to me what makes it interesting when you get to weave into a person's life. You know, as a homeopath, we spend 3 hours with our clients and we ask them so many questions and you learn a lot of things they've never shared with anyone else. And so that's why I think I love podcasting, because I keep getting to say why and why and why. I ask a lot of
Yeah.
questions because I have a curious mind. But one of the things that really struck me in your book, and that's also because I had the same experiences that you had, a near-death experience, which I too
Mm.
have experienced. So if you wouldn't mind, and it's not too personal, I'd love for you to tell the listeners about yours.
Yeah, thank you for asking. I think one of the reasons I wrote the book, I'll just share this also. The book idea came to me during meditation. And I remember when it came to me, it was very clear that was what the book was going to be about. And I really resisted because very few people, my family, maybe a couple of dear friends knew that I had a suicide attempt during medical school.
Mm,
And it was very clear during this meditation that this book needed to share about that. That was not just part, that was probably the impetus for me really going deep with my healing. That I was a medical student who was on the outside, everything seemed to be perfect. But the inside, I was falling apart. I was struggling with a lot of different things. And when I end up in the hospital after trying to take my own life, I remember seeing a resident, a young doctor, making her rounds at nighttime. And I'd had an IV in. I was being given medications to save myself. And I saw her, and I remember being so clear that I wanted to live, and I wanted to be a doctor, and I wanted to be a dancer. I wanted to be those things that were so passionate to me. But I had to start changing what I had been doing before, my relationships, my diet, my self love or lack thereof was not serving me well. And I could not live the life that I wanted to live. And so, I always say that sometimes you have to hit your rock bottom, and rock bottom does not have to look like taking your life, but sometimes you have to go to the darkness, right, to see that crack
for sure.
of light. So that's exactly what happened for me. And I think near-death experiences are nothing less than spiritual, because I really had I really feel like a spiritual awakening and a strong sense of things have to change. And then I had to get creative about what that looked like. And for me, that looked like, in different stages, changing my diet, setting healthy boundaries in my relationships, dancing more, going into the holistic health realm as opposed to just taking in traditional medicine.
That's so cool. I mean, your whole journey of just, I think, starting when you worked with the Doctors Without Borders. I mean, we do that. We call it Homeopathy Without Borders, and we go. They go to different countries, and you have to be in that lifestyle where you can leave your family or your husband. I've never been in a realm to do that, but I've always been attracted to that kind of work. So I think people that have those big philanthropic hearts and really that big compassion gene that they're born with, they're attracted to that kind of work. So obviously you had that in you, because when you went on that journey with the Doctors Without Borders, you already were fulfilling that part of you that felt the need to really help others. And then, the training that a medical doctor goes through, like my dad, he's old, but still the training isn't that different. And if I'd say anything, it's no different in nutrition. It's like one class or zero than it was even when my dad was there. But I think what's different now, it's even more like based off the pharmaceutical companies, and it's more in some ways, political with all the drug companies and things involved. And so for you to come out of that and then get on this journey and have this spiritual awakening is such a gift in a way, because I think, and I maybe want to ask you, like, how many doctors graduate from school that do you think that they begin to start questioning at some point that maybe what they learned isn't really healing or helping people? Or do you think that they're satisfied and they don't go there?
That's a great question. I just had the privilege of doing a dance performance and holistic health lecture to some residents at NYU in New York City. And a few of them came to me afterwards and were just thanking me, because I think what happens, and the answer to your question is, I think, yes, many people, many doctors or doctor in trainings do. I think a lot of doctors still, I'm not going to say all, I don't think it's all, but I think a lot of doctors still go into medicine to be of service to people. I think what happens, though, is the training, at least in America or in the Western world, and definitely in America, there's more and more protective laws around the hours of how much a doctor in training gets. But I can share with you, when I was in residency, I was working more than 80 hours a week. And what happens to you, your soul, something starts happening to your soul if you don't have a self-care practice that's really solid. And so I think a lot of residents, they may be doing everything they've been trained to do, but they're maybe not seeing results as quickly, or they see that they're not connecting with their patients because they literally don't have the time to do so, because they're so sleep deprived. So I know I did, and I know some friends of mine definitely asked the question, is what I was taught enough? Is what I was taught really? There's definitely those questions, but I think many people, it's so painful to look at that because of the amount of time and money and energy you've invested that you just push through, you keep going. For me, I couldn't just push through. I'd already had that near death experience, and I was like, if I'm going to be a doctor in this world, it has to be on terms that feel like integrity for me, that feel like self-care, that feel like true connection for me. I want to be clear about that. I think there are amazing physicians that I know of who are doing a very traditional route that still connect with their patients. But for me, it was a different flavor. And it was a flavor that included diet, that included mindfulness, that included a holistic approach.
Yeah, and it wouldn't really take that much change if you just left everything the way that it was and you made them do like a full year of nutrition, just really like, and with all the science behind it, like the China study science and all the science and you get the people, the experts, the Dr. Esselstyn and the Dr. Campbell and his son, who's a medical doctor, and all the practice of all these plant-based doctors that work with people, because that's really the only diet that has the true science behind it. We can talk about paleo and keto, but we don't see the paleo diet in cancer clinics, and we don't see the paleo diet reversing tumors. The science just isn't there. So this is what I always want to say about that. I know there's a lot of people that follow that, and it's kind of what I say, started as the Atkins diet and then got a facelift. Maybe it was Western Price, then Atkins, then GAPS, then paleo. Now it's keto, and it's kind of all the same thing, this high fat, high protein. Mm-hmm. But the science just isn't there.
The science is not there, and it's not as incredibly solid and, quite frankly, practical, because it also is in line with our anatomic and evolutionary, like how we're made as human beings in terms of what we have. My point being that fruit and plant foods is what we're designed to eat. And then also practically, I can just share with you, after being a doctor now for over 15 years and doing this work, prescribing plant foods to patients. And I get to work with a lot of people who are not vegan or plant-based, but they're willing to go into a detox or cleanse with me that's purely plant-based, and the results are stunning. So even from there's this research science, but also I just keep seeing it over and over and over and over again, and people being astounded by the numbers from their liver enzymes, people who've had non-alcoholic fatty liver disease completely cured, to definitely diabetes. I wanted to share this, if I had a dime for every time I hear in a market anywhere in the world, this is how far I think it's brainwashing has gone, when I hear people say, I can't eat that because I'm diabetic, in all these different languages all over the world. And they're talking about fruit, they're talking about berries and apples and bananas, but they have, in their basket red meat and white bread. It's astounding to me.
It's astounding.
And the data, I love sharing the data, especially in the beginning, before patients see their own numbers change, before they start seeing themselves heal. But as you said beautifully, the science backs it up there, and the studies continue to show that. Even I think as early, there was one in 2000, the British Medical Journal, BMJ, just a few years ago, did a study looking at over 100,000 people, and they showed that increase of fruits actually reduced the risk of type 2 diabetes. And this is not the only study, but there's just this whole fear of fruit and sugar. That's just one of the issues with. And people will lump fruit with Coca-Cola and candy bars.
I know.
Fruit, it's absurd, and the science shows that. So when you can point to that, sometimes that's helpful for people to give it a try. And then they start seeing their numbers, their hemoglobin A1C drop, their fasting sugar drop, the pounds drop in a healthy way.
I think too is the other problem is, with the internet being so convenient, you have such a vast amount of opinions and knowledge. And then you even get experts, like Dr. Mercola, he's a big keto diet. And, he produced a big video on the dangers of fruit and how the fruit sugar, the fructose in fruit is just as dangerous. And then when you get an expert who has millions of followers that says the very thing that we're trying to get out of people's fear, and then it's difficult. Like, people don't know where to go. I understand why people are confused. And it kind of comes down to like, well, who do I want to believe, you or that guy? You both say that you're experts, or you both have facts that say this. And so I understand the confusion. It's unfortunate, but the science does not back up anything that says fruit sugar is dangerous. Fruit sugar causes diabetes, that whole fruits and healthy fruits filled with all our minerals and healing vitamins and minerals have any harm in us. And yet this is what's touted in every book. Just kind of, it's like a parrot, just keep repeating the same false. It's not really a lie, because I don't think half the people saying it have studied it. They hear it, they say it, they were taught that, and they repeat it. And it's such a shame because it's such hard work now to get people to understand the value of fruit when it's probably the most healing food on the planet.
Absolutely. And again, I'll say two things. I love that you brought that up because it's so true how the internet is an incredible source of knowledge, but it's also an incredible source of misinformation. And misinformation can come from many people, even the ones who are quote unquote experts. And that's another reason why for me, I love empowering people by asking them to try things and see how they feel, as opposed to just absorbing information. And this requires some self-work and self awareness. Is the idea of, does that resonate with me? And if it resonates with you to eat animal flesh from animals who have been tortured all their lives and then killed, that's where you are at this point. But if something in you says to yourself, you know what, I would love an alternative, and it resonates with me to eat lots of fruits and vegetables, that feels right, but I'm worried about maybe it not being enough or it being too much sugar, as you said, like Dr. McCullough says. What I invite them to do is work with an expert who understands this, who lives it, and give it a try. Because what I see over and over again is people who work with me being shocked about not just the numbers, but how they feel, everything getting better.
Right.
And I think that when you do that, then you see, because I've also had many people coming up from keto, coming up from paleo, there've been all so many names for this, you're right. And maybe they lost some weight, maybe something got better initially, but sooner or later, things did not last, did not get long-term benefits. Cardiovascular disease does not get better on keto long-term, but on plant foods, absolutely. And then look at the anatomic evidence of us as true frugivores, which I think or plant-based eaters. We're not true carnivores. We don't have short guts. The length of our guts is about 12 times the length of our torso, which means that it takes a lot of time for things to digest. So we want things that are easy to digest, like fruits. We have opposable thumbs that are perfect for picking fruit. We have a full spectrum of color vision to discern ripe from unripe fruit. We are clear. There's so many signs. So many. So sometimes that can resonate with people, is reminding them of the anatomical evidence that we are not designed to be eating dead flesh.
That's a good point, because I think there's people who will resonate with that the moment you tell them that. But I always think that there's still a classification, and maybe it's just because of modern times that things like we kind of sometimes feel entitled that we work hard and we should be able to eat whatever we want because it's our reward system for everything else in our life being so chaotic and no sleep, and I'm being overly responsible for our family and everything. And so then they go out and get the pizza and the burgers and the chicken because it's convenient and it's addicting, and they get all the things in it that just keep making them addicted. But then I sometimes ask myself, is this just like a lack of willpower? Is it them wanting to believe in another diet just because it supports what their taste buds want them to eat? Or is it really just a lack of education and they really don't understand what they're doing? I'm not sure.
I will share with you my thoughts on that. I have a very strong opinion on that. I think at this day and age, with the internet, with the people that I've worked with, I've worked with people all over the world now. I'm privileged to have done that. I don't think it's a lack of education. Most people know.
That's what I would say too.
Like burgers and fries. I think it's very addictive food, and it's designed to be very addictive food. And here's the thing, you use the word reward. So you're right. Somebody who has a lot of stress in their life, whatever that looks like, they think, I just want to have my Ben and Jerry's. I just want to have that pizza. I just want to have this. What I share with people, what I ask them, and it makes sense, because here's the thing I'd love to offer, is that I think it's also about coping.
Yeah.
It's also about self-love. So how do you get through a day? If your life is hard or you're just going through struggle and you have that hit of a burger, you have that hit of pizza, you have that hit of bread, processed food, and you just get numbed out. And I speak about this from deep experience as someone who dealt with an eating disorder for years. So I'm not sitting from a high throne. I'm speaking from a place of deep experience and healing around this. So I want to speak to those people who know this is about emotional eating. I think there's a lot of emotional eating going on when you take food that's basically become a drug in our society, and it just numbs, it takes the edge off. That can feel like a reward, but what I tell to my clients and my patients is, does it feel like a reward the next morning when you wake up and you're sluggish? Does it feel like a reward after a few years and the weight is not coming off or it's piling on? Does it feel like a true reward when your mental focus is off, when your skin is damaged, when you're having problems with fertility? When you are having a heart attack, I could keep going on. It's not a reward. So I think what has to happen with people's minds is they have to start reframing this idea of, I'm going to treat myself to fill in the blank. It's not a treat. It might feel like a treat in those 30 seconds to 2 minutes to 5 minutes you're eating it. But most people know soon after they get the crash. And soon after that, they feel terrible. And soon after that, their mental focus goes down. So I think reframing these words is so important, and reframing the mind and saying what is true, what's a true reward for me? A true reward is being able to eat food that loves me back, so to speak. The foods that will really nourish you.
Yeah, I always try to tell my listeners, before you take a bite of anything, you ask yourself, like, is this really going to nourish my soul, my heart, my cells, my body? Is this fuel for my body, or is this just something that my mind is craving for whatever reason, emotional eating, grief, frustration, anger? But if it's not serving you, then I think if we could think before we eat, just like we were taught to think before we speak, we've probably forgotten all of those things, but we could make a lot better decisions, because I too am like you. I have to believe it's not a lack of education. And to me, from being here in LA, we have a big poor population, and you see these people, and they're the ones that are eating the fast food, but a lot of it is because they're already working 2 jobs. And when you can buy a bucket of Kentucky Fried Chicken, a whole big bucket for $4.99, and then you can barely buy 2 vegetables that won't feed your family, they do that and just delay I think they know it's not right, but also some of it is financial, but you have to find a way to eat plant-based and eat healthy food still.
I love that you brought this up, because I see those patients, those very people, a lot of the clinics I work with are taking care of lower income patients, and I feel privileged to try to support them. And there's this also misunderstanding that eating a fruit-based diet, or definitely a plant-based diet, has to be expensive, and it doesn't have to be. Now, is it true that in America meat is heavily subsidized? Absolutely. But if you are eating things like beans and you're getting them in bulk, you're getting sweet potatoes, which are amazing food. If you're eating cooked food, sweet potatoes are so full of beta carotene and antioxidants and higher in fiber than regular potatoes, and you can buy a bunch of them cheaply. If you're buying things like bananas in bulk, which are super cheap, you can do this. You can do this. And here's the other thing. There's a hidden expense, right? There's a hidden expense from eating the bucket of Kentucky Fried Chicken when you start missing days at work because you're sick. And I see those patients all the time, wanting disability, needing that help because they're not well, so there's a hidden cost. It's not as cheap as some people think that it is.
That's true. Let's talk for a minute, because this is something I'd really love to have a discussion with you. Now, I know that we all, if we're a raw food believer, then each one of us that believe that try to eat as much and high raw as possible. Some are very successful and do it 100%. Some do it 90, some do it 70. And maybe, as you said, maybe individually, some people do better on a little bit of cooked food for many different reasons we can speak about. But what do you think? I know it's hard to say the ideal diet, but I would like to talk about what do you think is the ideal diet? And if someone can't do that ideal diet, like how much cooked food? Because if you let me try to explain where I get a little bit not confused, but where it's a little difficult to explain to people. When you have the China study who did the plant-based diet science all in China throughout the whole region of China, and they proved that eating plant-based was by far healing and lowered all heart disease possibilities, and just everything was much better on this diet through the science of it. Then that was mostly eating grains and beans and cooked veggies. And I would say, of course, it's eating salads and fruit. Of course, no diet is without that when it's plant-based. But I would say it included beans and grains. And let's even just say 50% or 60% cooked foods. And still it was very healing. So I would like to know, like, this is where some people get a little bit lost. Like, well, why should I eat raw if I can eat like that? And the science shows all these benefits, right? So I would like to know your idea on the ideal diet for us. And then, is it okay if people are eating cooked beans and grains? Because many people tout the dangers of those.
Great question. So I feel, I went through the anatomic evidence of what we ideally should be eating in terms of plant foods, and there's evidence for that. When you get into the specifics of raw and cooked, I really believe that there's a lot of great evidence, not as scientific in the sense of published evidence-based work. Now, this is a very important point right here, that just because we don't have the evidence based on large populations doesn't mean that it's not true. Mm-hmm. So what I'm trying to say is, anecdotally and in my experience, people who want to heal do incredibly well on living foods in which enzymes haven't been altered or heated as cooked food is. So if there's this pinnacle, I do believe it is living fruits first, really, because they're really the most healing food, the most water-rich, antioxidant-rich foods. And then you have the vegetables and the greens, and then you can have your nuts and seeds. But here's the also thing we have to consider is where you live and how we have evolved as a species in different populations. In China, where there is a very strong winter and cold season, it wouldn't make sense to be looking at tropical fruits and how people do with oranges and papayas. It's just not aligned with culture nor with the climate. So my point is, if we could all live in the Garden of Eden and be in the Canary Islands or right in Africa or the Caribbean and eating fruits from the tree, right, in beautiful, rich soil where the fruits are still as nutrient dense as they used to be in the past, I think that this is amazing and truly ideal. But that's not the reality for 99% of people. So this is why I love an individualized approach. I love to meet people, Deborah, with where they are. Mm-hmm. The vast majority of people, if I see somebody who's coming, for example, off a keto diet, I'm not going to put them in an all papaya feast. Like that doesn't, like the detox would be so hard. They would, it's just not. So meeting people where they are. And what I say, the vast majority just need to eat more fruits and vegetables. Ideally, as much fresh and living as possible, but definitely I think some cooked vegetables, of course, great. Legumes, especially if you prepare them well in terms of soaking and trying to reduce the anti-nutrients, amazing, especially if you're in regions where that's easier to get, where you have the seasons. So I don't know if you feel like I'm answering the question, but my point is looking at people where they are, individually, where they're living regionally in the world, and then where they are on their health journey, physically, mentally, and emotionally. Because here's the other thing. If you're living even in a place that is full of these beautiful, vibrant fruits, but you're mentally not ready for that, I've also seen people hurt themselves yo-yoing between oh, I need to be 100% raw. And they can't do it for many reasons. And they yo-yo back to pizzas, and it can be a horrible result.
And I also think that even if someone's gung-ho and ready, if their diet was processed foods before, going all fruit overnight is going to make you very sick. It's not even recommended. Now, if someone's 4th stage cancer and been given 4 weeks to live, you've got no choice.
There you go.
My teacher, Dr. Morse, one of my, mentors who I did my iridology and detox training with, he would tell someone like that, drink only grape juice. That's it. You're given 4 weeks to leave. We don't have time. You just drink grape juice. And he's had so many cures of cancer of people just drinking grape juice that are but when you're at an end like that, when you've got a very extreme diagnosis and illness, then you need a very extreme approach because you don't have time on your side. But
you need the purest. You need the purest and most healing approach, and that's what I mean by meeting people where they are. That's a beautiful example of that.
Now, what about for vegetables, raw vegetables? Because here's my personal. I've tried probably 4 times in my life to be 100% raw. And each time that I've done it, like this last time was the longest, and it was a year and a half. And I'm almost still all raw, but still, I just will tell you my battle with when I become a 100% living food person is I begin to consume too many nuts and fats. And I look at other raw food diets, or raw foodists, people that are raw foodists, and I see the same in their diets that I feel in mine. And I don't like that. And I don't feel good with that, because if I look, let's say, at the study behind the science behind the China study, which is a very low fat diet. And I think for people like Dr. Esselstyn's patients who all had advanced cardiovascular disease. And of course, he's putting them on diets, not even with many avocados in it at that point. Forget any nuts. That's not, oil's gone. All their recipes are like oil-free, nut-free, because he doesn't want the fat in there because they have advanced cardiovascular disease. That makes a lot of sense. If somebody has no problem with their cardiovascular problem, then they want to eat a handful of nuts and a little bit of avocado and olive oil. I don't have a problem with that, because like you said, you have to individualize. But when I started doing like raw food, because then you make a lot of your sauces for your zucchini noodles. You're making like nut sauces and pesto sauces with nuts. And then it's just like, even if you want an occasional dessert, then it's with usually a nut. But there's just so many ways to eat nuts and fats, because you start feeling that that's your food that makes you feel more full easy. Although I can feel really full on fruits enough. I actually did easier doing all fruits than I did trying to incorporate other raw foods, because it eliminates nuts. You're just doing fruit. It was easier for me.
Yeah.
So, but that's always the hard part for me, versus, let's say, being 85% raw and eat fruit for breakfast and fruit for lunch and any snack, fruit. And then dinner, maybe a salad and maybe like steamed yam, or maybe it's some broccoli or asparagus that's cooked. But that felt better for me than consuming the high fat protein of the nuts that I would consume when I was raw. And I wonder if you've come across this yourself, or what you think about it.
I love you shared that. And again, I think that it speaks again to individuality. And it also speaks to this idea of this, what's the word, deifying, putting on this throne 100% raw. And I don't get it. The only thing I can think about is that I feel like it's tied to what you asked me before. What is the ideal diet? And even that, I kind of hesitated, because I think once we start thinking that way, or some people start thinking that way, then it's like, well, I need to strive for that. And that's why I quickly said you have to also honor where you are in the world and where you are with yourself, because it might not be the ideal diet for you. And I think you just gave another great example of maybe 100% raw is not right for you, that you are actually healthier. What you described, if you're eating 30%, 40% or more of your calories coming from fats, and you're not feeling great, that's not as healthy as if you're incorporating a little bit of cooked food, cooked healthy food, and feeling better. For me, that's really clear. But I think we can start struggling with, I should be, it's ideal to be. And I think letting go of the shoulds and feeling into where do I feel my most vibrant and going from there. And then when you do that, then maybe in the future you get to a place where you say, okay, now I'm in a place where I can let go a little bit of this other food. But maybe you don't. And that's fine. That's still your ideal diet. Personally, I'll speak for myself personally as a counterexample, while I'm honoring your example, because I've met many people who say exactly what you're saying. And I say to them, please have that cooked sweet potato. Please have that steamed kale, please, because that's so much healthier than this alternative you're speaking of, where you're eating tons of nut butters and you're not getting in nutrient dense and antioxidant rich food. For me personally, I actually have found that I am healthier, and in terms of vibrance, mental focus, quote unquote, the numbers in terms of blood work, how I feel by eating 100%, you could say 99.999%, because there's always this thing of, are cashews really raw, all this stuff, but it's an all raw diet. Mm-hmm. I feel my best on that, and it's easier for me. It's more easeful for me to do that than actually incorporating cooked grains or cooked other things. And that's been my journey. But my point is that I don't believe there's one way for everyone. If we're all, again, living in one place, we're all the same personality types, we're all whatever, the same exact genes, maybe. But I think we've let that go. And I think kind of getting 80% versus 90% versus 100% is just more stress than it's worth.
Time to take a break and get a nice drink of pure distilled water, because that's the only water that I think is actually pure. Even natural spring water contains plastic nanomolecules, and I sure don't want to be drinking those. And what about the toxins from our acid rain and all the pollutions? No, thank you. I'll enjoy my pure distilled water and get my minerals from my high fruit and veggie diet, especially high raw diet, because they're filled with the essential minerals we need. Fruit is where we can get our natural water from, so eat more fruit, you guys. And don't forget to use my Amazon banner on my site for all your Amazon purchases. I just get a small chunk of change for every purchase, and it costs you nothing. But every bit of help can help support my work, and it's very much appreciated. And my new banner is right on the first page of my site. Just go right below the banner photo of me and you'll see it right there. And lastly, please pass on this episode of this podcast to a few friends or anyone else that you know needs help, doesn't feel well, wants to feel better, is really sick. It doesn't matter. Just pass on the show to them, because I'm sure they can learn to heal themselves. I really believe in the body's ability to heal itself, but we just need the right education and the right information. And if you also sign up for my site, then you know you're going to receive updates when I have a new blog. You're going to receive special offerings for my paid services. So be sure that you're signed up on my website, okay? All right, you guys, let's get back to that conversation that I'm having with Dr. Tumi. In your experience of eating 100% raw, do you consume many nuts in the day, including nuts that you would use for any sauces or milks or anything like that?
That's a lovely question. I can just share with you what so I'm pregnant now, so I'm actually incorporating more fats. Uh-huh. Before I was pregnant, I wasn't also shy of nuts and seeds, but I wasn't having very much. I would say my fat percentage was probably around 15% a day.
Yeah, that's
so
good.
That would be like an avocado. My sauces, I don't usually do a lot of nuts and seeds. I'll put like zucchini and a date and make a marinara sauce. This was in the past, but I have made fattier sauces, but I might put a little bit of nuts, but then I thin it out with zucchini. I have a YouTube channel actually for anyone who's interested with lots of raw food recipes, so you can see that.
What's the name? Is it under your name, Dr. Tumi?
It's called The Poem Dances, all one word, ThePoemDances. The Poem Dances
Great.
has my dance work in there. And so that's my YouTube channel. Also has a lot of videos on there about fruit preventing diabetes, fruit preventing liver disease, my holistic health tips, as well as lots of raw vegan recipes. So there are these tricks one can do, right, to thin the fat out. But I think what's huge for me is that I'm fruit based.
Yeah.
I would not, if I was not fruit based, I would not be able to be all raw. I know that for me personally.
Me too. I mean, that's why I
I
said it
can't.
was easier for fruit than it was to say being raw, because fruit is just so different than eating
Yeah.
veggies. And is it true that there's some veggies? Because once I interviewed a guy who had cancer and he did raw food to heal, but then he went on saying he couldn't sustain his weight. And so he went on to cook food, and now he more recommends just a vegan diet, but not a raw vegan diet. And he was saying like certain things like a tomato. Okay. So you have all the enzymes when you don't cook it, but when you cook it down and you use more tomatoes, and you get a higher amount of lycopene because you're getting more nutrients from the amount. Like, what's the value of an argument like that?
I love hearing that, because the short answer to that is, for me, it's reductive, which means it's like taking one step forward and then another step back. Look, again, cooked tomatoes, amazing. Raw tomatoes, though, you might not get as much lycopene, but you get all these other things that have been cooked down.
Right.
And you can get lycopene from watermelon, from other vegetables and fruits in the amount that you need. We're not lycopene deficient.
Yeah.
So that argument is not, for me, an argument against raw. But I just, the whole raw versus cooked debate, I think is so, I think it just needs to be let go. And I think when people do that, then they'll find their own quote unquote happy place. And I really do. And I think there's too many rules and there's too many shoulds.
Yeah.
And I think the reason I've been successfully raw for as long as I have is I've never done that. I already had a history of eating disorders. I was like, I'm not going to get into that journey. It needs to feel liberating. If I feel like I'm doing raw because I have to, I'm not going to stay raw. I do raw because I feel amazing on it, because every day I choose to do it. It's a choice, not a obligation. And I think whether you're doing cooked or raw, some percentage, let it come from a place of self-love and from choice, is what I would say to people who struggle with this.
Yeah. And I think, like you said, it depends where you're starting. Like with my patients, I used to say, how about just one day a week eating vegan Mondays, because it didn't matter to me if it was cooked or raw, because from where they're starting, even all cooked vegan one day would be a good start. But then you have people like myself that have been evolving in their diet and doing all kinds of, more extreme things. And that's my own personal journey. And I think the more that you know about what is the best diet for our anatomy and our body, then the more you want to feed that to your body. But that doesn't we're all human. It's still difficult.
Absolutely.
We still have food cravings. We can still have, but they're mental. They're not cravings. They're emotional, they're mental. And when you do a lot of fasting or dry fasting, or even like we did 11 days on grape juice, and we did 10 or 12 days on a juice feast, just doing juices. When you do things like that, you fight your internal demons about food. And that's one of the things I love about fasting, and that, because it makes your willpower stronger, because you're determined to do it.
I love that you brought up fasting, Deborah. So before I got pregnant, I'm not fasting anymore, but before I got pregnant, every moon, so every time my monthly flow would happen, I would do my knee, and I speak about this in my book also. I talk about the importance of not just physical rest, but digestive rest. And it was a very organic evolution. And that's why I also love that you use the word evolution of your diet and your journey. Is it happened very organically for me, is that I started very organically wanting to incorporate periods of digestive rest. And with my new moon flow, or you can call it your period or your menstrual time for women who are premenopausal, it's a beautiful time to do fasting, to really just, and fasting might look for you, depending again where you're coming from. It might look like you're just doing fruits and vegetables, or you're cutting out oils and overt fats. It might look like you're just doing liquids. It might look like you're doing water for a couple of days. But wherever you are fasting, giving your body digestive rest, I would do that every month, and then every season with the equinox. And the solstice, I would also do like a 5-day fast of some sort, or digestive rest, a cleanse. And I think it's so true what you said. It helps emotionally and mentally with, first of all, physically helps you just cleanse your taste buds and hone them even more.
Right.
So your home, what you go back to is that fresh fruits and vegetables, is clean food, as opposed to numbing those taste buds with more processed and heavy foods. Those cleanses are so helpful for resetting your nutritional milieu, your nutritional landscape. So I'm so glad you brought that up.
And I think too is like, it's a step of, like you said, we're just so used to kind of eating whenever we want. And I think when you give your body a digestive rest, since it's 85% of the body's energy is spent in digestion, why not just give it a break once in a while? But it's also, everybody's different. Like you said, some people just can't do it without any food, and maybe they just do one meal a day and for 5 days, or other people want to just do it on water, and some people on juice. Although traditional fasting, water fasting there's even hospitals in Europe that do this. And now in America, we have some fasting clinics where they do a lot of water fasting. But at the same time, I also can say I think it's not right for everyone either to do a big water fast. It should be supervised, because if they're toxic and they're dumping out all these heavy metals, they're going to put themselves in danger. But I do think the way you're saying to do it, according to what's right for you, and at 3-4 days, pretty much anybody could do that. That's not something that you have to worry about. But I think if you want to do a long water fast, like 10 days or more, then you have to be more supervised, or at least be able to rest.
No, absolutely. I think, a long-term water fast, I would absolutely say please get supervision, because for people I've seen also, they may not even know when your consciousness changes. And so you may not even be aware of when things are shifting for you. And there are amazing centers now. There's True North Center in California. There are tons where you have really well-trained, Dr. Clapper is somebody I really highly respect, other physicians who have training in this and experience in this, doing this work. So I'm speaking about smaller short-term, and also, again, respecting where you are, respecting where you're coming from.
Right. Now, Dr. Tumi, what do you think about fruit versus fruit juice?
Worlds apart.
Yeah.
And it's a big thing I speak about with my diabetics, because I'll say, yes, please have fruit, and I've had the opportunity to help lots of diabetics come off their medications. They no longer meet the diabetes criteria with lots of fruits, but not fruit juice. And the big thing I always say to people who especially are struggling with sugar issues or blood sugar abnormalities is that the fruit sugar is, with fruit juice, you have basically the fiber stripped away. And the fiber is really important for slowing down the absorption of sugar in the body. And so this is why I think, again, whole fruits are always superior to fruit juice. If, again, you're struggling, especially with metabolic issues, blood sugar issues. Now, if you're somebody who is extremely healthy, or if you're somebody who is only doing who doesn't have any blood sugar abnormalities, but is trying to heal something. You made the great example of grape juice, right? So you'd say, well, what about grape juice? Grape juice is, and let's be very clear, this is non-pasteurized, freshly pressed fruit juice. This is not, pasteurized fruit juice is a whole other animal.
Yeah, forget that. I'm talking about freshly pressed.
Exactly, freshly pressed. For some people, I do believe that it can be very healing. I don't really guide people through fruit juice fast, because it's not my area of expertise. But you've mentioned Dr. Morse, and there are other there are other practitioners who've had amazing results, but especially with very almost terminally ill or terminally ill patients.
Yeah.
With high grape juice is incredible medicine. It's so full of anthocyanins, which are antioxidants that are cancer fighters. They're powerful cancer fighters. So you have that concentrate in the juice and you're not doing anything else. So you have no fat in the way, you have no protein. It's just medicine being injected to those people's cells and letting the body do the healing work. So in that context, I can see it working really well. But for your average person who's just trying to clean up their diet, I would say really stick more to the whole fruits as opposed to fruit juices. Mm-hmm. But you can also, if you want to do green juices with some fruit juice in there to balance it out, no problem.
Yeah. So is it any different for greens, eating greens or veggies and green juice?
So I think with green juices, when you have a little bit of green, so for a great example would be having celery and kale and you put a couple apples in. The amount of sugar load is not the same as it would be if you just had pure apple juice. You know, it's a little bit different. Is that what your question is?
Well, I was thinking more, what about eating the kale and the celery versus juicing the kale and the celery? Is it the same issue?
Yeah, great question. So yeah, basically the same thing again as fiber, but the difference there is that you don't have the sugar issue with green juice as you would with fruits. So, but fiber is something that's missing in many people's diets. I'm always encouraging eating the whole vegetable or the fruit when you can. Now, other people also have sometimes problems getting in the volume of vegetables, right? They're really busy. Those people, I say, please take it. I prescribe green smoothies all the time for that. Yeah. The green smoothies are a little bit different, right? Because they've got the fiber.
Right.
Still in
That's
there.
what I was going to say. Is that the good happy median then? Because then you're getting the veggies, but more pre-digested.
Exactly. I believe so. And I think that's the best form for most people in the usual world who are I have a lot of very busy patients and clients. Green smoothies are a lifesaver and they need that fiber, especially if they're coming from diets, the SAD diet or the keto diet to help their colon cleanse and clean out.
And then what do you think about certain veggies in a raw food diet that some people say are better cooked, like root veggies like kale. Beets and kale and or even what's some of the other root vegetables like turnips or
the oxalate rich like chard. So I would say what the data shows is that you need to eat a huge volume of these raw for it to be a problem. One of the big concerns with kale, especially I'll speak on, is thyroid. So if you have a history of thyroid disease, there is this idea that a lot of raw kale can be goitrotropic, so it can cause goiters or more thyroid disease. So for people who are having thyroid issues, I tend to recommend that they don't eat huge amounts of kale. But at the same time, most people are not going to want to eat huge amounts of kale. So this is another great example of, again, why we shouldn't just be juicing all the time. Because if we're eating as human beings, if you eat chard, I love chard. But if I eat chard, I can't eat more than a cup of raw chard because there's that metallic taste to it, right? So when we're eating these foods, we can really, our intuitive and our evolutionary sense and comes into play and lets us know when we've had enough. But when we're juicing and we're mixing it up with all these things, sometimes we lose that. So that's how people can end up eating like so many pounds of kale in one sitting. And I don't recommend that. But eating a little bit every single day or eating quite a bit a few times a week, absolutely fine.
And what about something like a sweet potato? That's a root veggie that some people say is healthier cooked than raw. What are your thoughts on that?
I don't recommend eating potato raw.
Yeah. Or what about a beet?
With beets, what I do with them, I'll just speak personally, is I juice them. They're look at that color. That color is bursting with antioxidants. So juicing beets with some celery and a little bit of apple and maybe some greens and a lime or lemon, amazing. But eating the beet, I have had raw beets, but they're usually slivered because again, if you chomp on a beet, it's not the most pleasant taste.
Right. I make a really good salad with a slivered, like a shredded beet salad with apples and beets together and then some little sunflower seeds on it. It's really yummy. Fantastic. And just the dressing's just lemon juice. but it's really good. But then I've always heard like they're better eaten cooked than raw. And I wonder if there's a danger in eating them raw.
There's no danger as long as, again, the amount is okay. And you're not going to eat several pounds of beets in one sitting. Your body's not going to do it.
Right.
So I think there are these things that are built in to help us with those things. And I always say to people, if you just feel uncomfortable, there's a plethora of other vegetables to choose from.
Yeah.
Like no problem. That nature has been abundant with the plethora. And that's I just want to say that I think one other thing I love about our conversation, Deborah, is I feel like this diet, I don't care, call raw, cooked, but fruit-based plant food diet, it's such a beautiful testament to abundance rather than deprivation. Because it's a food where, right, you can eat as much as you care for. Your body knows when it's full. It's fruit trees are the most abundant plants. They just keep giving and giving, and the seeds go back and keep giving. It's such a beautiful testament to that. And I think people will say this, and this might sound woo-woo, but I've experienced it. Many people have. There's another element we haven't talked about. We've stayed with science. But there's definitely an added element to eating living foods and eating fresh foods, cooked or not, where you feel this vitality. And you feel this connection with nature. And I feel like you feel this interconnectedness with other people. And I felt it so much with eating living foods. So
yeah, and I think that elevates up another level, don't you? I think it starts when people go from animal-based diets to vegan diets cooked. I always feel that I said when you become a vegan, even if it's a cooked vegan, the compassion gene gets turned on. But then I think it elevates even more when you become a living food person, because that life force in the food, when you see David Wolf's photography of, the picture of an organic apple and even a non-organic is different. But then you take an apple versus a piece of meat. It's just like you imagine that's what you're putting in your body is that aura, that energy, all those colors. And then you can understand why it's so healing. So I agree with that. It's a certain kind of awakening that happens on a much more spiritual or just, I don't know, it's really a lot about compassion and life and energy and just connection.
Yes, so well said. I totally agree.
Do you know Dr. Sebi? Or
yes,
he's
I'm
passed
very
away.
Familiar with his work.
Yeah, are you familiar with his work?
With his work. Mm-hmm. Yeah.
And what did you think about his work?
I thought it was incredible. I think he's made an incredible contribution.
What an amazing person. I wish I would have met him.
Me too. I think he'll be remembered, and I think it was tragic. I think his loss is tragic, but I think his work will live on for sure.
Because his work is really a lot about alkaline, and I think that's what's so great about the living diet is it's automatically alkaline, and he was so much about the alkaline balance and the alkaline diet. And I think some people get confused when they hear of a high fruit-based diet because you're eating things like lemons and limes and oranges, and they say, how can that be alkaline when they're acidic? But maybe you can help explain that myth.
Yeah. So what we care about when we talk about alkalinity, we care about the mineral composition of what the food breaks down to in the body. So having something be acidic in your mouth or sour tasting is not the same thing as what pH results from digesting that food. Lemons and limes are a fantastic example because they have that acidic taste to them. But when you digest a ripe lemon or lime, in the stomach, you have the production of beautiful minerals like potassium, magnesium. All of these are alkaline minerals rather than acidic minerals. And so fruits are the most alkalinizing, no matter what they may taste like in the mouth, as long as they're ripe. I wanted to make that really clear distinction because if you're eating an unripe fruit, you might have issues with pH, with digestion. But if you're eating a ripe fruit, even if it might be sour or acidic tasting, alkalinity is the result. And that's another reason why they're one of the most healing foods on the planet.
Yeah, that's and it's automatically happening. That's what's cool. You don't have to think it through, or you just
Yes.
eat raw and you're already eating alkaline. It's really a cool phenomenon that it's taken care of. What about water? So if you're eating a high fruit diet, have you found that you've had to drink less water because the fruit is filled with so much?
I love that you brought that up. Absolutely. I think it doesn't get you can't get better filtered water than from what a plant does, right? What fruit does. So, for example, I had watermelon for breakfast, and I think I had maybe a cup of water when I first woke up with some lemon, actually, some lemon squeezed in. That was all the water. And I had my dance practice. I went out for a walk and a run, and then I came back and I had watermelon for breakfast, and I have gotten all the water. I'm super hydrated. And again, when you're eating a lot of living foods, you don't have the dehydration that comes from cooked foods or fried foods or baked foods. You're getting in all that water in your fruits and your vegetables, especially the fruits. So yes, I have definitely for myself, and I've seen with clients also, usually they've been told you have to have so much water.
Right.
And usually when I start with the detox, I do say increase your water intake a little bit especially for those people who are struggling with caffeine addictions, and I'm getting them off their coffee. But then afterwards, they can really cut down the water, and they're just eating more water-rich fruits. And they are astounded about how great and hydrated they feel on a much more balanced level, as opposed to just having water where you're not having all those electrolytes and minerals also that you find in the fruits.
I know when we did our only fruit, I don't think I had a glass of water in a year. I know that sounds weird, but I was just eating so much fruit. And in season, watermelon is like my favorite. So that's just so much watermelon. I could, just throw the watermelon in my blender if it wasn't like that great of a watermelon and a little bit like fuzzy, if you know how watermelons can get not crisp or something. I just throw it in the blender because it's still sweet.
Yes.
And it still has all the fiber, but it's still filled. Yeah. It's just watermelon. There's nothing added. And I would drink the whole thing down. And of course, it's so good for your kidneys and flushing everything out. And there just never felt a need to drink water because I was just eating so many fruits. So I know a lot of fruitarians that have transitioned into that area. It's not like they're not trying to drink water, but if they feel thirsty, they go eat a fruit.
Yes.
Because you're getting the water with all nature's minerals all built right into it. So there's no better water than that. Well, I won't keep you much longer, but I'll just ask you a few simple little questions at the end here. I just would like to know how you think the world would be different if we'd all stop eating animals.
Oh, I dream. It's, I meditate every day, and I feel like every once in a while, I put that prayer out. I put that prayer out into the world. I really do. I still have that hope because I think the amount of self-compassion, and I tear up just thinking about it, the amount of self-compassion, not just compassion for others, because that would definitely increase, but self-compassion, because I think so much of the violence we see comes from actually a self-hate that people are carrying. And so I think compassion for other beings, compassion for our planet, and self-compassion would increase in ways I don't think even you and I, or at least I, can imagine. And I think we would have the world that we were meant to have, that I feel like humans have the potential to have. We're incredible species, and I think that we have the potential to be stewards of the earth, stewards for other species, true light beings. And I really believe that releasing, bringing that energy of death and suffering and violence into our bodies as a collective would bring about the world we would all want to see.
Yeah, I totally agree with that. It's also a dream, and how sad, for the animals who are sentient beings. That kills me all my life knowing this. That's why I couldn't eat an animal as a kid, because I couldn't break the relationship of my own dog and the cow or the chicken. But
Yeah.
Yeah, it's a dream, and I hope more and more people, but in the end, it's like the poor animals are getting suffered and murdered, but in the end, they give revenge of the health of the human dying from eating them. So it's unfortunate that people can't see how, well, I mean, I think they see it, but as you said, I don't think it's from a lack of education anymore. It's just that sometimes they're choosing the keto or paleo because it supports what they want to eat rather than what they want to know about their health. So maybe someday soon we see more and more. It's moving in that direction. More and more
It
people are
definitely
eating
is.
plant-based, that's
Yeah.
for sure.
Yes. Oh, I'm seeing it. I will tell you again, because of the traveling we do, to see the progress of that all over the world is incredible. I was living in Paris for a stint about 10 years ago, and I would go to a place and say, I'm vegan. And the waiter would say to me, why do you bother to wake up in the morning? Like one waiter actually
Wow.
said that to me. But I go to Paris now. We're in Paris last summer, and there were a lot of vegan places, and there was even one or two raw vegan places that were incredible. So there is an increased consciousness all over. And I brought up Paris, but even when you go to smaller places and smaller towns all over the world, I think there's just an increased consciousness and awareness happening. So I think people are waking up to themselves and
Me
to
too. Yeah.
the reality.
Me
Yeah.
too. And another question I have is, do you think that the world, or at least America, because I think the state of our insurance and our doctor care is so crashing, and do you think that we would be better off having health insurance and sick insurance? Because what I think we have today is really
Mhm.
only sick insurance, because they only pay for you when you get your cancer, but they don't pay for you to do things like colonics or massage or homeopathy that could help prevent you from there. So do you think that would be a beneficial direction?
Absolutely. I think it's happening. I mean, I know other fellow physicians, I mean, with my practice and other fellow physicians who are lobbying to have preventative um, practices, nutritional care, partnering with homeopaths or acupuncturists for all that stuff to be covered. And I think a lot of more and more slowly companies are waking up to the fact that, okay, when this happens, people stay well and they don't cost them so much money, like, because that's the language they speak.
Yep.
So I think it's happening. I really, really believe that it's moving that direction also.
Cool. And in your book, there were two things that I really loved what you said. One thing was when you talked about how when patients came to see you or Skyped with you or paid to see you because they wanted to make the journey themselves, that they almost always got well. But when someone was gifted like a certificate or a gift, say, oh, go see Dr.
Mm-hmm.
Tumi, they didn't get as well. I had this experience too. The people that asked, because maybe they either, let's say I helped their wife and they got better, and then the wife kept nagging the husband, you got to go see Deborah. You got to go see Deborah. And the husband's rolling his eyes going, I don't need to go see Deborah. But finally he comes to see me, but then they don't get as well because I don't know. I don't believe that it's a placebo effect, but I just think when you're ready, you're willing. And when you're not ready, you're not as willing. And it's funny you said that in yours. Oh, I really related to that. So maybe you can talk about that.
I think you said it beautifully. When you're ready, the flesh, the mind, the spirit is ready. Until the student is ready, and I don't say, I was going to use the word student and teacher, and I don't mean us as teachers, but the knowledge, the healing, we're vessels for being the teacher.
For sure.
If the student is not ready, the teacher can be doing jumping jacks in front of the student. They're not going to see that. So I am such a believer in honoring people where they are. I know I keep saying that, but here's another great example of that. If the person is not ready, let them be. It's their journey. And that can be very hard on the ego. It can be very hard for loved ones to hear that.
Very hard. I think that is one of the hardest things, Dr. Tumi. If you were raw and you're having to watch your husband eat a killing diet like that, you see is that is so unhealthy, that has to be so hard.
I think that there's an incredible lesson there in because that's one example of just acceptance of the other, even as you believe that to be um, detrimental. And I feel like there's a level of letting go and acceptance. And here's the interesting thing about that that acceptance of other is I've seen so many times this interesting thing when you let go, when you release the attachment of I need that person to be well or to do what I think they need to do to be well. All of a sudden you stop pushing it. You just live your life. All of a sudden the person's tapping you on the shoulder and is like, can I try that food? Or who is that person you said I should go see? I've seen it happen so many times. And I've seen it happen in my life. Be the change you want to see as opposed to trying to preach it so much. Thank God for the preachers, but be the change and let others be. And I think that can be the most powerful way, actually, of bringing people to health and light.
I totally agree there. And another difficult thing is sometimes you're not even trying to get the other person to change. But every time you go out to eat, they kind of go, oh, your diet, and it's so difficult, and I can't live my life anymore. I have my best friends like this, like they're all frustrated with her because, oh, now you're raw, and now we really can't do this. And I don't think it's really fair because she's not, harping on them about what they're eating, but they can't get off of her case about how her diet is when she's a breast cancer survivor. It should be accepted.
No. I have very strong opinions about that. As any of my clients will tell you, there's a huge thing of when I say you accept others, also honor yourself enough to be accepted by others. So if that's not happening in your life, healthy boundaries need to be set, especially if you are in a life and death situation and you're fighting for breast cancer or whatever. My mother is a breast cancer survivor, and I applaud the way she has set healthy boundaries in her life to be now cancer-free for over 15 years. Healthy boundaries, I think, is one of the most important things. And it's something we didn't talk about, but it's a beautiful lesson you can learn through changing your diet, because I don't have that conversation with people anymore. People now come to me and they say, can you make this raw food for me? I have so many friends who eat a completely different diet from me. Not once will they ever offer me meat or anything or complain to me. And that I think is a lot about me having chosen people in my life. And the ones who I can't choose because it's family members, there's something about energetic setting of boundaries. There's something about that I think really, that might be triggering for some people to hear, because I'm not trying to blame people, but I'm actually trying to empower you to set those boundaries. Your life is too important. It's too important.
Yeah, good advice. And the other thing in your book that I love was with the part you talked about movement and play. And I know you're a dancer and that's natural and easy for you. But and I'm an athlete as a golfer. And so I have a lot of injuries from my accident and from all my years of golf. But I found the coolest thing lately in LA, it's this thing called GST Body, but it's kind of like it's almost like Pilates and yoga, but it's probably more like gyrotonics, if anyone knows what that is. Yeah. But anyways, it's this movement and it's like cross movements and dancing movements, and it's just all about movement, and my back has never been better, and I'm so excited about it. Nice. So when I was reading your book, I'm like, cool. And then I'm watching your videos of how you dance. I'm like, wow, no wonder your body's so healthy. But I really appreciated that in your book. And I think that's such an important part of health that people just don't do because they're working so much.
Thank you for mentioning that, Deborah. And I love, because of your history, your past as a pro golfer, and now as I really believe we're all movers. We're meant to be moving. My baby in my belly is moving constantly. We've been moving since we were in our mother's wombs. And I think what happens in the world for many people is that they stop moving as we should. And movement, I really believe, should be woven into our daily life. I would love for it to be less about gym time for half an hour a few times a week and more about play throughout the day with your child, taking a break during work to do some squats or a little bit of dancing or whatever, having it seamlessly woven in through your life. That's our legacy. That's how we are built. And that's how we get sick, because we don't do that. And so I love that you brought up this component, because it's not all about the food. And in fact, I think they go so hand in hand, because as you eat more of a plant foods diet and more of a living foods diet, your energy is freed up to really be the mover you're meant to be. And when you're eating sick food or food that's not really food, your body doesn't move as well. And so the two go so beautifully hand in hand.
Yeah. Wow. That was really nicely said. Thank you for that. And then we'll just end by, I want you to tell listeners like where they can buy your book and how they can follow your work. You mentioned the YouTube channel, but also tell them your website. And then after that, give us 3 tips or some advices that you can get the listeners motivated today.
I love that. So the best place to reach me is through my website. It's my holistic health website, and that's www.drtumijohnson.com. So DRTUMIJOHNSON. And from there, that will take you to the book, that will take you to my webinars. I have webinars on how to be successful on a living foods diet, as well as healing fibroids naturally, which is a huge issue for many women. So I have webinars on that, and I have resources, articles I've written. Then my YouTube channel and my Instagram page. Instagram, I post a lot of foods that I'm eating. I post my dances. YouTube, I have holistic health tips every week, or dances. And the handles for both of those is the poem dances again. So those are the 2 places, my website and then social media through the poem dances to reach me.
Great. Awesome. And now
then
3 tips.
3 tips. 3 tips. And tell me again, 3 tips to just get people motivated.
Yeah,
is
just for people who want to like do a little better than they're doing. Where should they start?
Yeah. I would start with, I just did it, what I think you should start with breath. I would start by taking so many of us are walking through our lives and through our days, not really breathing, taking a deep breath, taking a big inhale, letting everything go, releasing tension, taking a moment to step into yourself even more and be present. Because I think from there, things just become clearer where you need to go right now, where you need to go the next day in any aspect of your life. I believe it begins with presence. And so breathe. First is breathe. The second thing I would say is be kind to yourself and do a little bit every day. Just be kind to yourself. Sometimes I think we have this goal. The New Year's is very notorious for this. We have this goal list of what we want to do. And then by March, we're totally disillusioned with ourselves and upset with ourselves because we haven't achieved everything. And I think what I've seen with people, with my clients and patients, is set just one intention for yourself, one intention for the next couple of months, whether it's I want to move more every day. I want to eat one meal that is full of living foods. One thing, keep it simple, focus. And when you do that and you just do a little bit of that every single day for a while, as opposed to trying to do 10 things every single day, I really believe this is a path to more progress and to more quicker progress. And it's just kinder to yourself.
Oh, that's great advice. And everybody can do one thing a day.
Yeah.
For
yeah,
sure.
I really believe that. And then the third thing I would say, it's kind of related to number 2, but I think it's so important. I think it connects back to everything we've talked about, is to do one kind thing for yourself every single day and one kind thing for another being. I think for me, they're connected. It's not 2 things. Do one kind thing for yourself and one kind thing for another being every single day. I think if we came from that place of love, self-love, and understanding that self-love is connected to love of other beings, we would make better food choices. We would make better movement choices. We would make better choices in our relationships and with our work. I don't think we speak enough about kindness and a kindness towards ourselves. So that's the third thing I would say is going back to self-compassion.
Oh, that's so beautiful, because also giving to others really is a gift back to yourself in the end. It's
Yes.
so amazing how powerful that gift is. So love that. Thank you so much, Dr. Tumi, not only for sharing your personal experience. I know you kind of open your soul in your book, and it's so beautiful to read that. And I love hearing people's story from Hellville to Wellville. That's always so cool. And, when you come to LA, we have to do it again. We have so many things we can talk about. So I'm just happy to have connected with you. And thank you so much for all the goodness that you're giving to the world and all the good work you're doing in the world, and for being on my show today. I really appreciate it.
That feels really good to receive, Deborah. And thank you for inviting me. And thank you for spreading the word with compassion and with honesty and authenticity. Thank you for the work you're doing.
So you're welcome. And I just feel like it is my work in the world. And I love to meet people like you, because like that, this is, my friend Reese always says we're the light workers of the world, but I don't want to be, it's not anything that's on an ego place. And it's, as you said, we're not even the teachers, but we're the workers that walk beside them and support our patients, right? Because they need that. Support is so critical in times of change. And for the level of health that people have to heal from, they need support. So this is what we can offer the most, along with our knowledge.
So well put. I love how you said that. I can't wait. When I come back to LA, I'm definitely going to send you a message. I would love to meet you, give you a hug in person, maybe have more conversation. I feel like we could talk for hours and hours.
I know. And we'll have a big fruit bowl together.
Yes.
Yay.
Yes.
All right. Well, thank you so much.
Thank you.
Wasn't that a real and genuine conversation? Yet I still hope you learned so much. I love how Dr. Tumi shared her journey of all her depression and even her attempted suicide, and then how she found her answer through working with Doctors Without Borders, where she just saw firsthand how food was the healing medicine of these poor, sick people that she was treating. That was life-changing, and that time allowed her to implement what she saw and learned to truly heal herself. And it's always the fact that, I would say not always, but almost always the fact that people that are healers because they were on a journey to heal themselves. And they did, and has to share that with the world. So every MD or doctor that learns this message of how food is medicine, it's become such a huge potential in the world to really heal their patients. And Dr. Tumi is really doing her share of it for sure. What a happy person she is, and what a great person. I really loved her. And I wished you guys could have seen her smile, because I did a Skype with her. And it's just resonating pure love and joy. And you just get that feeling how much she really wants to help people. And if you get a chance, you gotta watch her dance. You can just go to drtumijohnson.com. She has a video right there. You get to see a little bit of it, but just go to her YouTube channel or her Instagram. It's so beautiful to watch her body move, and she's so vibrant. And I love more than anything that this is not an expert that just talks the talk, but she's an expert that's walking the walk. She eats a high living diet, high fruit. I would call her a fruitarian because it's really high fruit, which is what I'm always striving to do and doing, but I'm always in that mission where I want most of my diet as much fruit as possible and the rest as much raw as possible. But anyways, I just love being with her, because then I could ask her all the tough questions like, what about raw vegan versus cooked vegan? And what about juicing fruit versus whole fruits? And what about the high-fat vegan diet versus the high-fat raw diet versus the low-fat? And I just wanted to hear her experiences working with other patients, because I have those questions often too, and I have my own experience, and it's so nice to share it with someone else. And I loved hearing about how her patients accepted this medicine plan because it's so far, away from what the medical society offers people. But I agree when she says you just have to meet people where they're at, step by step by step. And I love that she said at the end, when you do one thing every day that's good for yourself and one thing for others, it can change your life. And I think that's great advice. And really, I believe if we all did something that was good for ourselves, meaning in our health, in our body, mental, emotional, spiritual, whatever, and something really nice for somebody else, we would really be on the way to healing the world with love. Well, you guys, I think I should let you go because it's been a long one, but a great one. And I so love the feeling of you around my table here every time I do a podcast. And today I especially felt your energy there. It felt so free and conversational. And you guys are my Vidal speakers, and you are my podcast family. I always miss you, and I always love you. And I always love feeling your energy around my table. But you know what time it is, right, my podcast family? Yep, it's time to say goodbye. Vidal has spoken. Remember, you heal with a plant-powered diet, homeopathy, and detoxing, of course. And don't forget to add all that fruit. Peace. Be healthy. Be free. Live life.